Okay, so as we've talked about the clickbait newsreel that came out in Arizona discussing the millions of complications with dental implants, let's again kind of go back to some of the video. We're going to take some still shots from that video. And so let's take a look here. We've got the before, or the photo of the lady who had the work done. She's got her fingers in her mouth and trying to retract. So we'll do our best to try to demonstrate. But you can see here, implant positioning is not optimal. She's got, you know, 2 implants over here that are separated by quite a bit. And then on the other side of the arch, she's got 2 implants that are right next to each other. Now let's take a look at a case from Trust Implants, or not just from Trust Implants, but from somebody who has background, training, skill set, and this is what they do. Whether it's here at Trust Implants or another doctor somewhere out in the country who has bona fide training, you're not going to see this type of work. You're not going to see this poor quality of work, which makes for a great newsreel, but in reality, it's not the reality of the current landscape of implant dentistry. And so here's the before photo with the lady who had the complications, and rightfully so. Implant positioning is poor. I'm sure the implant materials are poor. I can't really say exactly because I haven't seen an x-ray. I've never met this person, but you know, given the distribution of implants and the location of these implants, I'm pretty sure that this was done by somebody who has no background training or ethics for that matter. Now take a look at a case you would see here at Trust Implants. Notice nice even distribution of implants. Notice the gum tissue, it's nice and healthy and pink. But more importantly, notice the prosthesis, the teeth themselves. I mean, it's a fixed prosthetic, does not come out. You know, in the news piece, the lady's able to kick her teeth out with her tongue. She says they're constantly coming out. And that's not real implant dentistry. So if you're seeing a doctor and they're recommending doing or if they give you the option, well, you can do removable or you can do fixed. When we talk about implants, if you're going to make that sort of an investment, you definitely want to go fixed. There's no reason to do removable. If you're going to go through all the steps of having implants placed, make sure that whoever places those implants has background, training, and skill set to be able to deliver on what they've promised. You know, we see a lot of cases. I'll show you a few here. You know, here's a patient ended up in the wrong hands and spent thousands and thousands of dollars. And as you can see here, everything has failed. Implants have failed. Prosthetics have failed. And as a result, we had to take everything out and redo the entire case. You know, versus a case where you see nice implant distribution, healthy tissue, healthy prosthetics, and ideal mechanics, so how the implants are placed, the positioning of the implants, and how the load factors are. And I sound like a broken, you know, record, but saying the same thing over and over. Implant distribution, biomechanics are key to success. And then also, of course, compliance, patient compliance, you know, selecting and knowing how to manage different anatomical landmarks, whether it's the sinus, whether it's the inferior nerve, knowing how to work around and customize for each patient what is the most optimal treatment, rather than kind of haphazardly putting implants in whatever location and then crossing our fingers or hoping for the best outcome. When we have control, the control starts at the beginning when I first meet the patient, when the patient signs up and I put my plan together. I'm already starting to think about the end result. And that's how we are able to end up with aesthetics and function that look like this. And so, yeah, you know, I'm sure the complication rate has gone up, especially with the, you know, all-on-4 centers popping up on every corner and putting a delicate, very, a procedure that needs to be done by somebody who's trained and putting that same procedure and dumbing it down and putting it in the hands of somebody who is not trained, without a doubt the complication rate in the FDA is going to see a lot more complications and failures if that's the case. And so, with that being said, it's important that as a consumer that you find somebody who has training, who can show you results like this, and just know that you're in the very best hands, because it is an investment, but it's worth every penny. There's no price that we can put on replacing an organ, or replacing an arm or a leg, or replacing your mouth or your teeth. It's a priceless procedure, but we are able to do it. We do it with confidence. We do it with high level of success. And so with that being said, I know that this news piece that's kind of gone viral on the internet, it's pretty easy to fall into the trap of thinking, oh, implants are horrible. They have a horrible success rate. But in the right hands and with the right approach, with the right materials, both surgically and prosthetically. So everything from the implant material to the graft material down to the prosthetic materials, if all of that is executed properly, as well as implant positioning and planning, the results are incredible. And so with that being said, I just kind of wanted to show the difference. Here is the patient who had all these complications, ended up on the news, but what does implant dentistry truly look like? And this is what it truly looks like. This is what you should expect. This is what you should demand if you're having these procedures done. So just, I just want to kind of clear the air. Implants are very successful. We have a very high success rate. It's a lifelong procedure, but it's got to be done in the right hands. And also we have to choose our patients wisely. If the patient has a long history of smoking, there's a lot of variables and factors we have to consider as practitioners. When I do a case, I have to look at the patient and determine, is this a good case or is this a good patient that will continue to maintain and be a good environment for an artificial prosthesis or artificial teeth and implants. A lot of times I see patients, when I meet them, the environment is not great. That's why I'm having to a lot of times remove all their teeth, whether it's from periodontal disease or smoking or whatever the reason may be. We're having to take their teeth out. So they really have to change their habits. And as they go through the process, we found in our practice that the patient appreciates the end result so much that they've changed their habits and their mindset. And they really do end up maintaining and taking care of the prosthetic that we've worked so hard to give them. So with that being said, it is important to choose a practitioner, an implant center that really does a lot of cases and doesn't just offer an all-on-4 or a removable prosthesis, but can give you different options and show you results that you can look at, you can say, yeah, this is exactly what I want. So I'm Dr. Willardsen, and thank you for watching.